Hey everybody, I'm about 1 month post-op bottom surgery, phalloplasty, with Dr. Crane in Austin, Texas, and it's at its new practice. So I flew down here about a month ago, had my pre-op, and had my surgery, and I'm about to fly back in 2 days now. So I haven't made a video earlier just because I haven't been feeling the best. This surgery took a toll on my body like I had thought but didn't expect. So yeah, the surgery was around 8 hours. Dr. Crane said it would be around 7 to 8 hours. I got everything. I got the phalloplasty, urethral lengthening, scrotoplasty, glandsplasty, vaginectomy, everything. When I first woke up from surgery, I was in so much pain. I don't remember, but according to my grandma, I was in so much pain that I was screaming, "Why did I do this to myself? I wish I didn't do this." Obviously, that's not what I feel, but in the moment, it hurt that much. I was in the hospital for 5 days. There I recovered. I had the nurses watch me every hour for the first couple days, and then I got transferred out of the ICU to, I don't know, the other place in the hospital, but there they only watched me every 2 hours and then every 4 hours. On the 4th day, I got up and I walked to a chair, sat down in the chair for most of the day, and the 5th day, I got up and walked around, and then I was discharged. I thought walking would be a lot harder than it actually was, but it wasn't that hard. I think the hardest thing about walking was my leg, because the way I actually had the forearm one, as you can see, my arm, where they took the nerves, the skin, artery, vein, all from here. You can tell where they took the vein. And then they used that to form the phallus, and then they took a graft from my leg, which right now is pretty red right here. So that was originally covered in a gauze dressing with something called zero form on it. So I couldn't actually, my leg wasn't this red, but when I was walking around, it caused a lot of burning, a lot of stretching. I wasn't used to it. I hadn't walked in a couple days. When I was in the hospital, they used this thing, a Doppler device, which you can listen to like a heartbeat through. It's kind of like an ultrasound, a mini ultrasound. So they would put that on the phallus so they could check the blood flow, make sure everything was okay. I had no issues in the hospital. Everything was looking good. Did have a bit of swelling. That swelling is still maintained, so it's still red. It's kind of right above, on the right side, right above my leg, more towards the groin. But out of the hospital, I went to stay at a post-op center because that's how they do it in Canada. They sent us down here, and we have a month of care with nurses at a post-op center. And so I laid in bed the first couple days, and then I got tired of it. I'm not the type of person that can just lay around all day, so I got up and started walking around, and then my leg started burning, and I took pain medication every 4 hours as I could until the burning subsided within 2 to 4 days. And then the zero form dressing, it would kind of dry and peel off at the corners. And eventually that's where the red was the underneath. My arm started off looking kind of gnarly, not too bad, not as bad as I expected it to look. The graft worked really well, and it's only recently that a part right here at the bottom didn't take. I'd say it's about this big, but it should heal. A friend of mine who was just a week ahead of me was here too, and he actually got to remove this. He didn't have this on, but because I have that little spot, I still have that. I got this arm brace, just like wear it like this and strap these down. Originally to keep my wrists mobile, and then I started doing I went to the hand therapist, started doing some exercises like this, and rolling a ball like that. things to kind of get mobile in my wrist. I used to not be able to turn my hand more than this. Now I can do this. So it's like not quite, but I'll get back there. In terms of the pain, well, the pain wasn't where I expected. I have no feeling in the phallus itself, so I had no pain there. The pain was in the vaginectomy. It was definitely in the scrotoplasty. It was pretty much everywhere. It rotated. I had pain in my bladder, although a weird thing, the feelings in my bladder actually, I felt it in the vaginectomy instead, which apparently is normal. It's called referred pain, but it definitely surprised me. I had a couple of fevers. I actually have a fever right now, and I have for a while. Bladder spasms. I had bladder spasms. Those aren't fun. I had one, and I went to the emergency because I thought it was a UTI. And I've been checked now twice at emergency for infections, but I've had none. I've had a catheter. I had a big catheter bag in the hospital, but now I just have this. It's just like a little valve thing. Anyways, it allowed me to train my bladder to get strong again for me after using a catheter. So I would feel when I'd have to go, and I'd go flip it down, empty it. A couple days ago, I started bladder training, so that's where I can actually use my new urethra. So I measure that out of there, see how much I go, and then use the catheter, measure how much comes out of there, and if I have more than 75 to 25 is the ratio I'm aiming for, or less. So far, from the very first day, I've had exactly that. I had a couple of times where I didn't, when I have to go, I have to go. A couple times I didn't, I waited a bit, and that was a bad idea. It was everywhere, so don't do that. Every day I have to get up, I shower, I have to put a bag on my arm because I can't let my arm get wet, so I shower with one arm. Not as easy as you'd think. Then I do my arm dressing after, so this gets all taken off. I'm actually wearing like a sleeve, and then there's like gauze, and then there's, there used to be something called a daptic. It just prevents the gauze from sticking to your ointment, which I had bacitracin. It's kind of like an antibacterial. And then my arm. So that, and then I had to get bacitracin also put on all my stitches and sutures, and I had to have a bladder irrigation every 2 days too. So they would put saline mixed with some an antibiotic, and they would put it into my valve thing, and the catheter would go right into my bladder, since I have a suprapubic catheter. So it means it goes right into my bladder. And they do that every 2 days. I've been on 2 sets of antibiotics, a lot of medication, muscle spasm, bladder spasm, anxiety meds, ibuprofen, Vicodin, Tylenol 3s, like so many medications. I actually took the Vicodin for 2.5 weeks and didn't wean myself off, and then I ran out, and I went through a bit of withdrawal. So if I had to do anything over, it would be trying to wean myself off earlier. I think that's really important. People don't think about that, but it can happen that fast. Now I'm barely on any pain medication. I just take ibuprofen sometimes. I'm not in a lot of pain now. That's pretty much stopped. The most pain I get is here in my wrist after a day, because it's just not used to it, and especially with the exercises and just kind of moving my arm around gets tired. I'm very happy with the length, very happy with the width, everything, the girth, every way it turned out was better than I could have imagined, and I wasn't actually expecting that since I have a pretty small forearm. I don't know if you can tell, but so small forearm doesn't mean anything. I got 5 inches, and that is exactly what I was aiming for. So I'll do another update when I get home, but hope this was a quick and good summary of my experience so far. And yeah, thanks.